5 folks tonight, so we're going to kick it off with Michelle Moghadassi, who is the Senior Informatics Program Manager for the Informatics Hub here at IGHS, and I will hand my mic to Michelle.
So I'm in a dim hallway in a hospital in Tehran. I'm there with my father. We haven't been there for a very long time. It's 1996. And we haven't been since before the revolution, since before the war that took my grandfather. And we're walking along, and I'm just seething in pain, cramping, and I'm feeling horrible. I'm leaning on my dad. And we're walking through, there's dark water stains on the low ceilings. And I'm just hoping I can make it to the restroom. I'm there with my uncle who looks just like him. And they're worried about me. I've been losing fluids rapidly for 2 days. I'm just feeling so nauseous and that pain that is just taking my breath away. I'm hoping I could just make it down the hall to the restroom. Luckily, my uncle happens to know a doctor at this facility too, so we're managed to get in. I make it to the end of the hallway, and we get there, I go inside, and it's like that dark seafoam green that we think of Scrubs of the OR room. The air is really stale. Whatever ventilation systems used to work are no longer there. And again, I'm feeling that racking pain, sweat between my shoulder blades and under my armpits. I've got my headscarf that just keeps slipping and this jacket that I have to maneuver, and I'm going inside. The toilet is one of those squat toilets too, so I'm thinking, God, I hope I don't fall in. And I'm just trying to navigate all of these gymnastics. So I managed to use the restroom, and I get out and I go to the sink. I swipe some cold water across my forehead, and I reach for the soap, but nothing's there. And the nurse, she looks in on me and she says, "The doctors steal the soap." And I don't know what to make of this. I'm 22 years old at this time, and these are questions I'm thinking about is why would they do that? I mean, was there, are they keeping it for themselves? Are they keeping it for certain patients? Are they just hoarding it? Is there a black market for Irish Spring soap? I mean, I have no idea. And I have no idea what had gotten me so sick and how I'm feeling so terrible. These are the kinds of things that start to pop into my mind, a glimpse at health systems, what's happening in broken systems and what is beyond just how complicated it is to take care of patients and keep people healthy. This leads me into my thinking and career path down public health, down epidemiology. Fast forward. It's a late Friday afternoon, and I'm in an off-road vehicle in Western Kenya. We're driving through, the red dust is kicking up all over the car. We're driving through really tall sugar cane fields. I'm 44 years old and probably too old to be starting a career in global health after 15 years doing domestic research. But I'm there, I'm shadowing a monitoring and evaluation team for HIV in that area, so we're going to be tracking HIV cases that are going on over there. It's a really long drive, it's about an hour and a half. I am still jet lagged, I'm hungry, it's just a really tired, long day. We finally get there. It's about an hour and a half drive, and the facility in charge is not there to greet us at this very small facility. It's just a social worker. So we get out of the vehicle, and I'm heading off to the side room with my colleague, as usual. We're looking for the patient registry book. So it's those really thick black tomes, almost like a Harry Potter book of spells. Just endless lists and names of patients and columns for their age and their gender and their test dates and treatment dates and everything. So we're going to be tallying all of this. So we start to work, and I hear the phone of our team lead buzzing. So I look down the hall, and I walk over there, and a few people have gathered around, and it's an alert. There's some kind of notification coming in that there's a new HIV case in this catchment area. It's a female, 6 weeks old. So at first, I kind of hold my breath at what that means. A few words exchanged with the social worker, and she is out the door. She knows where this mom lives and is going to go out and find her and bring her back. About 20-30 minutes later, they return with this mom who's tired. I mean, she's exhausted. She's a new mom. She's dealing with her own health as well. And all I see is this team that just kind of seamlessly, just really quickly and smoothly, they just bring her in, comforting words. I don't know what they're saying. It's in Luo, but she's seated on the dusty chair. and they're putting a really warm hand on her shoulder. Just kind of, it seemed like reassuring her that things were gonna be okay. There's no judgment at all in their tone or in her sense of being. They hand me the baby and they ask if I can just go to the next room and weigh her, so my colleague and I go over there. And I put her on the scale, she's just barely bigger than my 2 hands. And I don't need to see the numbers on the scale to know that she is light. She is very light. She's, her dry mouth is already speckled white with thrush. So I pick her up and I take her back into the main room. I give them the weight information and they're quickly able to look up the dosages on the charts that are up on the wall. And they're explaining to the mom, the dropper for the ART, for her medication, for the antifungal for the infection in her mouth. And just while I'm watching all of this unfold, I'm just observing. I don't know how to help, or there's nothing I can do. So I'm just holding the baby. I prop her up onto my shoulder. And there's a kind of instinct that sets in, sort of that parental muscle memory of just rocking back and forth, like I did with my daughter, my baby girl 12 years earlier. So I'm just absentmindedly, rubbing her back, and I can feel her small spine and her little ribs through the thin t-shirt. And to be clear, this baby doesn't need any soothing from me. She's calm. And I think that probably this is much more comforting to me, the swaying, the contact with her small body. And I'm listening to the team that's explaining everything to the mom. I finally hand back the baby. They send the mom back on her way. I discreetly let out my breath, relief, gratitude, hope. This baby, they registered for her care. It was very haphazard on some forms, but it's good enough. The in-charge is going to be back on Monday, but I can just feel my breath leaving my body. We eventually get back in the car, heading back, driving through in the night. When we had gotten up that morning and were starting to head out into these various facilities that we went to, I was imagining that we would be doing counting and kind of making sure that we were tracking numbers of cases and kind of the tallies and all of the mechanics of all of this. And sure, there was that. But in this situation, they had the technology that came into place and the job aids that were posted up for efficient dosages and all of these efficient workflows. But this was more than that. There was a human connection. There was kindness. There was compassion. There was no judgment. I'm 51 now, and my recent career has been in global health informatics, so a lot of data and numbers and dashboards and information. And I think about Fiti, who's my grumpy Dutch boss, and he's probably the best boss I've ever had. And he's so passionate about everything that he does. He's based in Nairobi. He's been living in East Africa for 20 years and been immersed in HIV systems for all this time. And he has such a care about this data. It has to be right, it has to be actionable. We have to be able to identify high-risk patients for the healthcare workers that need to take care of them. At the same time, we need to have the big picture and all the right data for all the public health workers that are in the ministries that need to make decisions about public health. We have a very large informatics team of software developers and business analysts and database architects, and he's reminding all of us all the time that the people behind these numbers matter. Their outcomes matter. So I'm thinking about all of this. I think about the landscape and this culture of cruelty that's come about. I think about how people are looking at compassion and empathy and ridiculing it. And vulnerability is being villainized almost. I think about how some people proclaim very proudly that some should be first over others, and that human beings should turn their back on other human beings. I hear all of this and I struggle to keep the optimism. I really struggle to think how we're gonna make change and to keep out from the doom and gloom. I sometimes feel like I'm just moving deck chairs on the Titanic. And yet I can't give in to just the doom and gloom and the despair. I think this is the time that we double down on our collective humanity. This is where I remember the people that we serve and remember the people behind the numbers, no matter how small they are or how far from our borders.